This government has decided to impose austerity on healthcare, and for 7 years now the NHS has been underfunded by over 3% per year. So since 2010 the NHS is now over 20% underfunded, and by 2020 the plan is that it would be actually over 30% underfunded. The stresses are now showing with the worst A&E waits for 10 years, cancer waits going up, elective waiting lists are nearly 4 million and projected to be 5 million in a year's time. It is just dangerous now.
84% of my colleagues in a survey last year said that their ability to provide safe patient care was undermined by their workload.
We end up in one of the biggest children's hospitals in the UK and in Europe, having no beds at all for children who are in A&E.
We had the Red Cross in January 2017 in England declaring that the NHS was a humanitarian crisis. Theresa May stood up and said there's nothing wrong. Jeremy Hunt stood up and said nothing's going on. It is a lie.
I think the underfunding of the NHS is a deliberate policy, and I think it goes hand in hand with the agenda to privatise the NHS.
Already, the majority of NHS contracts being awarded are going to the private sector. Already, we're spending more and more public money on the private sector.
Whatever it is you believe in, whether it's education, NHS, you need to believe that these are going to go. Privatisation is about making money. That's what the NHS is going to be about.
This election is life and death for the National Health Service. I think it's actually at a precipice, and if we can remove the current government with its attitude of contempt and lack of respect for the health service and replace it with a government that believes once again in healthcare as a public service, we will have done our children proud. Look at the pictures that we've seen of people on trolleys in A&E waiting to be seen or waiting to be admitted. The picture in January of a 2-year-old child waiting for 5 hours who may have meningitis, but 5 hours for an assessment to know whether they were ill or not, and lying on a homemade couch, lying on 2 chairs in their A&E until they were seen. Remember those images and think, is this good enough? And actually, please do not vote Conservative. As a paediatrician, the thing that hurts me most is the story such as a child with severe mental health problems needing admission in England, and the nearest hospital bed was in Scotland, and the parents had a 400-mile round trip to see their ill child. I've seen...
No, it's okay. That's okay, it's okay.
We know we live in a land with riches for all. We know the health visitor and firefighter contribute no less than the stockbroker and merchant banker. We know there is no chief executive or shareholder value without the worker. We know that wealth, privilege and power are carved up in an obscene fashion. We have had enough. We demand health, work, home, education and care in time of need. Not subject to grand profiteering, but planned, transparent, executed in efficient fashion under democratic control, using our intelligence and imagination. We demand the full fruits of our labour. We demand the right to contribute and recognise the obligation to share. Power concedes nothing without demand. It never did and it never will. We have one short, precious life. We demand the chance to be all that we can.